Hi, I'm Dr. Dan Shapiro. I'm a surgeon, plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and all I perform is cosmetic or aesthetic plastic surgery. Over the last couple of years, I've developed something called a GenXLift, and I have a lot of people coming in asking for the GenXLift and want to know what it is. Well, the GenXLift is something that I developed after researching patients and also techniques and really thought about what it is that patients are wanting that may be not ready for a facelift. And when I say that, there are many reasons that people may not go and have a facelift or a full facelift, and that is for really three main reasons. The first is that, it involves some recovery and some time off, and some patients just can't tolerate that in their busy schedules. Another is that a full facelift involving the forehead, the eyes, and the face, and the lower face, possibly some fat transfer, tends to be a little bit expensive, and people sometimes find that that's cost prohibitive and want to know, is there a way to get there that makes them happy and is more affordable for them? And the last being is that there are some patients that feel as though they may not be ready psychologically for a facelift. There are still a lot of people that facelift word scares them, and they're just not there yet. They may not be ready to go to the operating room. They want to know if there's something that they can do possibly in the office under oral or local sedation and some local anesthetic. Well, the GenXLift is a staged procedure that really addresses the continuum of aging that starts in the 30s and progresses all the way through the 50s and the late 50s, and those are the Gen Xers. The first stage of a GenXLift really addresses the skin and the loss of volume that happens in early aging. So people see skin pigmentation problems, people see loss of collagen elasticity, and also they see that loss of volume that happens around the eyes and the cheeks, along the jawline and the lips. So the first stage of a GenXLift actually addresses those two things with a combined laser therapy involving a micro laser peel along with a profractional laser. Both of those combined take care of pigmentation problems and also help that collagen replenish itself to increase the collagen elasticity. The second thing is that I do is I take some of your own fat from somewhere else in the body and I extract it, spin it in a centrifuge, and I re-inject that with a very small cannula. That is long-lasting fat, and it's kind of a two-for-oneer because you actually get some of that volume taken away from the donor site. Well, the next stage of the GenXLift is for people that have a little bit more progression of that aging continuum, and usually they see some early jowl formation or some laxity of the neck. They see that loss of definition of the neck and jawline. So with that next step, I do the first two things, that is the fat transfer along with some laser therapy, along with some rejuvenation of the neck, whether it be either liposuction, ultherapy, or possibly thermi, radiofrequency, which will tighten the skin, take care of some of that fat excess, and give you a more defined and graceful jawline. If there's more progression, and that's people generally in their mid to late 40s or in their 50s, have more of that jowl formation and more laxity along the jawline and cheek laxity, I combine the first two things, that is the laser therapy along with the fat transfer, with a short scar facelift. And that is something that is performed in the office under oral sedation with some local anesthesia. And there's some people that actually can do that in the operating room under IV sedation. That is a procedure that is not just a cheek lift, if you will, that is actually elevating the deep tissues of the jawline and the cheek back into a more youthful position and actually gives you that heart shape that you had of your face when you were younger. The beauty of that short scar facelift is that it does the deep tissue elevation with a much shorter recovery. So there are no scars generally behind the ears, into the hair, or anything like that. I think it's your secret, and it involves a much less recovery time. So basically, the best way to find out for you what a GenXLift is come in for a consultation, give me an idea about what you're looking for, always bring in some old photographs, and call and make an appointment. Thank you.